When you see parasites, you should be thinking immune system. Parasites actually have an important role in modulating in a positive way the immune system.
We really have to sort of take a step back, and we're going to dive deep into this conversation about, why we get parasites, what the symptoms are, and what our approach to diagnosing and treating it is quite different, and how it can affect so many different issues. Yeah. So, how come we get parasites?
How come we got parasites?
And is it a bad
I'll tell you
thing?
why.
Is it a bad thing?
Let me tell you why we have parasites. Because God made parasites, right? And God put them. He put them on this earth for a reason. And maybe the fact that our tests have been so antiquated for so long has been a good thing. Because I think if we had really good tests all the time, all along, we'd realize that most everybody has parasites. And they're in our gut for a reason. They really become a problem because there are some that are more pathogenic than others. But the real trick and trigger is, and I think why we see more parasitic based chronic disease is the immune system. If you have a hampered immune system, if your immune system is suppressed in any way or is out of balance, you're going to start to feel the impact of those parasites. And so why do we have them? Because they're part of the biologic ecosystem that works for plants and animals and for humans as well. It's when you get a big dose of a pathogenic organism, you happen to be immune compromised at that period of time, it gives you that opportunity for that parasite to take hold in your intestine, and now you're going to have either an acute illness, and most people have experienced parasitic illness as acute, like, Campylobacter, Giardia, Shigella, Salmonella.
Those are bacteria though, those aren't parasites.
Well, those are bacteria, but your Giardia is
Entamoeba.
Yeah, I was about the Entamoeba histolytica. Those are like two of the major ones. Yeah, amoebiasis. Those three, and those are the ones that people have experienced the most. And but the diagnosis to get to Giardia or Entamoeba histolytica, it can take months to years for somebody to figure out your chronic diarrhea is caused by one of those 2 or 3 parasites.
Yeah, I had a woman who had chronic fatigue, terrible irritable bowel, food sensitivity. She was like miserable. And it was like an extremely well-connected, wealthy woman who had access to the best medical care. And she had Giardia that she picked up somewhere, and she was miserable, and no one found it.
And it's very hard to find. You have to, one of the standard ways that it used to be used, and now I think they use capsules to go in and look for it. But they used to, go down into the intestine, and they'd be almost like fishing for the Giardia and see if they could pull any Giardia out and do biopsies. It's very difficult to diagnose. But we have new tests, but we'll talk about that.
Yeah, and people get parasites from water, from food. What kind of food and water?
Yeah. So you get it water, food. You can get it from meats, uncooked meats, and you can get it from your pets. So if you have a cat who's going out, it happens to be an outdoor cat that likes to kill things. They're going to get parasites from the rodents and the small creatures that they eat. They're going to bring it back, and if you're not careful cleaning their litter box, then you're going to be at risk for getting a parasite. With cats, it's toxoplasmosis. I actually have a patient who has schizophrenia, and I just did. Because I'm trying to find out a root cause, I did testing, and I tested him for toxoplasmosis antibodies, and he had very high antibodies of toxoplasmosis. And there's a link between toxoplasmosis and mental health disease, particularly schizophrenia.
Incredible.
Right. Even if it's treated. The inflammation and the antigenic nature of the toxoplasmosis has an ongoing impact on the brain in such a way that it can lead to the symptoms of schizophrenia. So It's interesting. It was an interesting case.
Yeah, it's really interesting. So that sort of brings together, like a different train of thinking, which is these parasites are in your gut, but they can cause problems that have nothing to do with seemingly have nothing to do with your gut. And I remember one kid with autism who was really quite sick, but had a lot of gut issues. And a lot of kids with autism have gut issues. And we're like, let's look at stool. And he had Giardia. Yeah. And we treated that, and literally the kid's autism dramatically improved, started talking. I was like, whoa, the whole So talk about the ways in which these parasites are common, and what are the most common ones we see, and how do we sort of start to think about like what they're doing in the body? Because in a way, you can make a devil's advocate argument and say, well, we all grew up in nature and we weren't living in a sanitized hygiene world, and we all were exposed to parasites, and we all had worms and amoebas and bacteria. Like maybe they have a role in our health.
Right.
Like,
so
are they all bad?
Yeah, so they're not all bad. And so, since you brought it up, I mean, that's the hygiene hypothesis. And that hygiene hypothesis says that industrialized countries where we have sanitized everything, including our food, we have lost some of the important elements of our gut microbiome, particularly parasites. And there's mounting evidence that parasites actually have a important role in modulating in a positive way the immune system. That there are particular parasites there's a balance in your immune system. And there's an inflammatory side and anti-inflammatory side. And the parasites that are in our body actually produce certain proteins and long chain carbohydrates and fat molecules that will balance out the immune response, so that there's the T helper cells that are more inflammatory are shut down. And so that can limit autoimmunity. And we know that autoimmune illnesses and autoimmunity is the base of many of our chronic diseases.
Yeah.
And so there's more and more evidence that having a healthy microbiome that includes some parasites can be very helpful. And I know we're probably going to talk about this, but it's called Helminth therapy. And although you don't hear a lot about it, it is becoming
a worm.
Yeah. Helminth is a worm, and they're being used to modulate the immune system. And I have a case that we'll talk about later in which I've used Hyman therapy. So that question mark about parasites, are they good or are they bad?
Yeah.
They're both.
It depends.
Both.
I mean, there's a really couple of good books. One is called Missing Microbes, which is about the damage to our microbiome and the lack of the right bugs that keeps us healthy. And then one's they call The Epidemic of Absence,
right?
Which is a brilliant book where this guy literally went to South America and Mexico and was suffering from allergies and asthma and autoimmune issues and treated himself with worms and actually got better. It was fascinating. But, this is such a crazy idea that people are like, wow, treating people with worms, that sounds like we want to get rid of the parasites.
Right.
But it's a mixed bag, and you have to sort of figure out what's going on with the patient. So let's talk about obviously digestive symptoms, right? If you have a parasite, you have diarrhea, you can have bloating, you have gas, constipation, cramping, all that stuff.
Right. You're going to have increased appetite. You're going to feel like you're never full. You're going to have muscle ache, joint pain. You're going to have skin rashes, itching, hives. You're going to have brain fog, fatigue. And in real severe cases, when you have a 35-foot tapeworm hanging out in your gut, you could be anemic. Significantly anemic. Iron deficiency. It would be an iron deficiency.
Nutritional deficiencies.
Yeah.
I've even seen cystic acne being caused by parasites. So they're common, and they cause a lot of issues, and they can lead to all these autoimmune issues you mentioned. And there's a lot of bugs in your gut, right? There's bacteria, there's viruses, there's fungi, there's parasites, there's worms. Did I forget anything? Prions probably or something, And I think the it's a complex subject. It's a look at the ecosystem in a gut. So essentially, it's like if you're a functional medicine doctor, it's like you're being a rainforest ecologist.
Yeah, there's
all these different interactions and all these dynamic connections, but the problem is really common, and the diagnosis is often missed. But often when I see parasites, I feel like they really need to be treated.
Absolutely.
And so tell me about how do we go about diagnosing this? What is wrong with traditional diagnosis?
Right.
And how do we start to diagnose this?
Yeah. So, I just go back to that one comment you made, because I think it's really profound. And I just want to really make it the last statement on this, is that when you see parasites, you should be thinking immune system. And you should be thinking, something is amiss in the immune system. But you should also be thinking about the fact that there's the good side, and that we need to have a diverse microbiome. That includes bacterial diversity, that includes parasitic diversity, because those organisms have evolved with us. They make compounds for us and they educate our immune system. See, if we don't have parasites and we don't have bacteria, then our immune system doesn't know. It doesn't know what to respond to. And so when you now have a sterile diet and without the nutrients that you should have, and you're not eating fresh vegetables, and you're not eating grass-fed beef, you're not going to get the full complement of bacteria and even parasites that will educate your immune system. What will happen then is your immune system will then over-respond. It's been in isolation all these years. It almost has agoraphobia. It's afraid to go out of the house, and it goes out of the house, and all of a sudden it's at Gillette Stadium, and it's completely having a panic attack. And when it does that, it over responds. You get these autoimmune and inflammatory responses that lead to chronic disease. And so it's really important to understand that we need to eat our food from really healthy soil. We need to eat whole food and vegetables that have these organisms on it, because that's going to help us have a diverse gut microbiome that has an abundance of good bacteria that helps protect us. And parasites are part of that. So that's the good side, right? Now, on the bad side, when you do have that problem, we talked about some of the signs and symptoms. How do you get to that diagnosis when that person's had chronic diarrhea, or they've had this itching and this bloating, and now you're suspecting, okay, they've had all this testing done and nobody's figured it out. See, that is an advantage we have, because we are oftentimes the doctors of last resort. Yeah. And so I get to look at everything that's been done, and I get to say, you know what? They did this and that, but oftentimes in 20 years of practicing conventional medicine, I think I had one positive O&P test.
Yeah,
right. GI doctors, chronic diarrhea, let's do an O&P. So what the O&P is basically is you have somebody in a lab looking under a microscope at multiple slides of somebody's poop. You have to look at hundreds of slides to capture one.
Yeah, and good luck if you might not recognize the guy's not trained. And one of their
you're right about that not trained. It's there are fewer and fewer lab techs.
Yeah.
That, like we don't, like if you and I saw, well, we'll probably get it, but if we wouldn't recognize smallpox because we've never seen it, right? So most of the techs these days, when they're trained, it's all on biochemical assays, and they're not getting the microscope, training and they don't see them.
And it may not be as common, like some of the bugs might not be as common here. So if you're in India and you're like a pathologist, you probably see thousands of, I recognize that.
So using an O&P, so if somebody comes here and I've had an ovum parasite test, I've had 3 of them, and I've been told I have no ovum parasites. Well, there's new technology called quantitative PCR. So what that does, it's going to look at the DNA material, look for DNA material of parasites. And it's going to be able to multiply it until you can measure it. That's what the PCR does. It's a polymerase chain reaction. So you get this DNA. That's kind of
what we use for COVID, right?
Yeah, exactly, for diagnosing the acute phase of COVID. So that test is very effective, and it's in part of one of the tests that we do to look at the gut microbiome. I use this one particular lab, and they do the quantitative PCR, and they're very, very sensitive. And they pick up parasites.
It's like 6,000 times more sensitive than looking at poop.
It is.
And the microscope.
It is.
That's
exactly
crazy, right? Okay,
so we have that diagnostic tool.
So let's talk about the approach to looking at parasites. We use a special test. We use what we call GI effects test here. It's a
GI map.
GI map.
I like the GI map because of its quantitative PCR. Yeah. It's very sensitive, almost too sensitive.
Yeah, it often picks up things that may not be actually.
But you get that with often.
So there's a difference between sensitivity and specificity in medicine. Sensitivity means if you have it, it will for sure find it.
Right.
But it can over-report it. Specificity means if you have this, it's for sure there. Like if you see
it's that thing. Right.
So, it kind of might over-diagnose stuff on some of these PCR tests because you may have like a fragment of something or it passes through and it may not be a real problem.
And you use your clinical judgment and what's going on with the patient to really, and that's the cognitive process that we go through all the time. And we don't treat tests, we treat patients. But we use tests so we don't guess. So that's how it works.
Let's talk about then how we would really approach dealing with someone with chronic parasite infections. And then I want to get into talking about worms because parasites and worms are quite different. I normally wouldn't give someone a parasite, but we sometimes in medicine are now giving people worms to treat disease.
Helminth therapy.
So talk about what is our approach? We do the diagnostic tests. What is our approach to treating a chronic parasitic infection? And we find them through these tests where other people don't find them.
So, we've gone through the process now. Patient comes in. We've clued into the fact that they have a parasite. We did great testing. We did the GI map. We found our parasite. And now what are we going to do? So there are, of course, in medicine, there are some drugs that you can use, but they are very potent and they have lots of side effects to them. And they, like you get more diarrhea, you can get more cramping, you can have hepatotoxicity with them. So you got to be really careful. They can be effective, and I've
like
used
Flagyl or Alinea.
Alinea, nitinol. But the two things I think about when I'm dealing with the parasite is if they have a symptomatic parasite, then their gut microbiome is significantly disordered, and you usually see not only the parasite, but you're also going to see other markers of disorder. You're going to see an overgrowth of pathogenic bacteria. You're going to see candida, because those are the markers of a disordered microbiome that will allow a parasite to really take hold and become pathogenic. Yeah. So I think first off, it's the 5 R's. So I need to get rid of the parasite. So we use botanicals. So the botanicals that are really helpful are oregano, herbs. So we use oregano, we use garlic, we use black walnut, we use wormwood. So I use berberine extract, and you can use them individually. Yep, and you can use them in combination. There are some great combo treatments out there that will cover a host of your parasites and also treat those dysbiotic or pathogenic organisms. So the first thing I want to do is I want to start them on a therapy that's going to finally get rid of that organism, right? Yeah. So it's a direct attack on the organism. But then we have to look at the entire.
Before you do that, I just want to share a story. I was once giving a talk at Yale, and it was to a bunch of doctors and naturopaths and. I was talking about the gut, and I mentioned a parasite, a particular patient, and this naturopath got up because I was saying, well, I tend to use these drugs, and because I kind of tend to use drugs more for parasites, and he starts going on and on about all the herbs and how these herbs work against parasites, and a minute later, this other guy got up who was a naturopath as well, but he was an older guy. Yeah, he's like, the truth is, I'm a naturopath and I primarily use herbs, but often they don't work as well as the medications. So you can try herbs, but I wouldn't be afraid of the medications.
No, absolutely
this is a short-term thing that deals with the cause.
Yeah.
And it's amazing. I mean, irritable bowel is so prevalent and it's such a big problem for people.
Yeah.
And there's many causes of it, but sometimes it is a parasite. Well, I had a patient recently who was a very famous lady and she was really struggling with chronic gut issues. And we treated a parasite and boom, she was instantly better.
Yeah. So again, Blastocystis hominis, which is a parasite, and another one called Entamoeba histolytica, they've both been implicated in IBS as triggers for IBS.
Irritable bowel, yeah.
Yeah. So you if you can't find a reason for somebody's IBS, and you should be looking for one, because IBS is just not the diagnosis, there's a trigger for it. You should, and you haven't been able to get to the bottom of it, you should be looking for those two parasites.
Unbelievable.
So we're treating, I will start with herbal therapies, and then I will advance to using pharmaceutical agents if necessary. But then I want to make sure the rest of their gut is working. So we look at their digestive processes. And oftentimes, why do we have the parasite? Because their digestive processes aren't working well. They're not making enough HCl in their stomach because they're under chronic stress. They might not be producing enough pancreatic enzymes. They may have some issues with their gallbladder that's limiting, and their liver that is limiting their production of bile or release of bile. So we want to make sure they have all their digestive enzymes. We want to make sure that their gut immune system is working well. So we want to create that environment. So besides treating, I'm going to want to make sure that they're getting the types of foods and supplements in their diet that will support a healthy gut microbiome. Good prebiotic foods, the cruciferous vegetables. I want them to make sure they're getting things like broccoli and asparagus and Brussels sprouts and dandelions. My dad was Greek, and we lived in a suburban community. And in the springtime, my dad would go around the yard and he'd get all the dandelions and he'd bring them in the house and he'd steam them up and boil them, and he'd mix them up with garlic and oregano and garlic and oregano. And dandelions, right? What are we doing? We're giving our gut great prebiotics to feed the good bacteria, and giving natural herbs and botanicals to make sure that we keep a healthy gut microbiome. So dandelions really good, artichokes really good, konjac root with glucomannan is really good prebiotic. So I want to not just treat the organism, I want to create a really healthy gut microbiome that has a healthy immune system that will prevent further disease down the road.
Yeah. So really it's about not only killing the bug, because often in traditional medicine, we're like,
let's kill it.
Kill the bug. Okay,
and
see you later.
Carpet bomb it and let's move on.
Forget it. And the problem is that most people's gut don't get back to normal on their own. And I often see this even with celiac patients. They will be told, oh, you have celiac, don't eat gluten, but they still struggle for years with all kinds of digestive issues that they cannot handle certain foods, or they have bloating or gas, and it's even after they've eliminated gluten. So you really have to go through this whole gut restoration program. We talked a lot about on the podcast, but it's such a key part of functional medicine, this 5R program where we get rid of the bad stuff, foods, bugs, whatever, and then we kind of put in the good stuff and help the body kind of repair and heal.
Yeah.
So that's really an incredible approach, and we've seen patient after patient who've had amazing, and I've come across really crazy things. I've seen people with schistosomiasis from Africa, and I've seen people with endemic histolytica, and I've seen a lot of parasites. Blastocystis is one of the most common ones. And it's often thought to be not a pathogenic one, so it's not bad. But it often does cause symptoms. And if people have symptoms and they have blastocystis and they have irritable bowel, I tend to treat it.
Absolutely.
You want to know my secrets for living a long and happy and healthy life? Well, all I have to do is check out my weekly newsletter, Mark's Picks, where I share my favorite tips for health, longevity, well-being, and lots more. Check it out, and link below. So let's sort of jump to this final topic, because I think that it's such an interesting topic.
Right.
And it has to do with worms.
Yeah.
So look, we all co-evolved with living with all these bugs.
Yeah.
And we had them and they live with us. What's interesting is that, in the advent of sort of modern civilization, we've become over-sanitized and we've lost the contact with the natural world. And I think we've seen this uptick in allergies, in asthma, in autoimmune diseases, in inflammatory diseases.
MS, rheumatoid arthritis, psoriatic arthritis.
And all these diseases. And the question is why?
Right.
Because when you go to like the developing world, or you go to a hunter-gatherer culture, they don't have them.
No.
Like there's just no allergies, no asthma. And I was thinking about the other day, like I grew up every summer spending 3 months on a ranch with horses and poop and outside and being dirty all the time.
Absolutely,
and the dirt
man.
and sleeping
Couldn't
outside.
wait.
And like being outside, and I don't have a single allergy or anything. And I think, there's this whole phenomena where you see kids who grow up on farms don't get allergies and autoimmunity.
Oh man, if mothers today saw what you and I were doing when we were kids, mucking around in creeks, holding on to salamanders, feeding, we had a horse farm near us, and, I would feed the horses, apples through the fence, and they're licking my hand, and, mothers today would be like freaked.
Right, exactly. So we've sort of over-sanitize ourselves, and there's a number of books like the Epidemic of Abstinence we mentioned. It really talks about this, and there's some really good science behind using worms, reintroducing worms into the body. And when you look at the part of the immune system that has us deal with worms, it's the same part of the immune system that helps us deal with allergy or asthma, which is fascinating to me because it's like, it has nothing better to do because it was supposed to be fighting the worms all the time and keeping everything under control. But if you don't have the worms to fight, all of a sudden the direction gets turned on you and your body starts dealing with attacking.
Exactly.
Becoming more allergic or autoimmune related.
So there's an interesting observation. There's observational study that looked at people with autoimmune diseases in sub-Saharan Africa and in underdeveloped countries. And they looked at those in regards to the severity of disease, progression of disease, and response to treatment compared to developed countries like the US. And they found that those patients in sub-Saharan, and they compared it along the lines of like the load of parasites. And they found that the patients in sub-Saharan Africa, and the hypothesis is that it's because of the parasites, they have their disease, their rheumatoid arthritis is less severe. It progresses more slowly and it responds better to therapy versus developed countries where there's less parasites. And we have this, the operation of the hygiene hypothesis where we just live in too sterile of an environment that our immune systems just are, like you said, are going to get confused and they're more likely to have an autoimmune response in response to something that's coming through the system that they maybe should not even respond to. That's called immune tolerance. Your body actually has to have immune tolerance. You have to tolerate your own antigens, but you have to tolerate the antigens of other organisms. Because if you're responding to everything that comes through your body, then you're going to be constantly inflamed. So your immune system has to have a mechanism by which it can appropriately tolerate organisms. And in that particular setting, those organisms that are being tolerated may be doing something good for us. So if we're having immune tolerance for a parasite that isn't harming us, it's getting some benefit, but it's creating compounds that actually modulate and balance our immune system, that's a win-win.
So I know this sounds completely wacky, right?
I know, but it's true.
Dr. Hyman and Dr. George are giving patients worms.
Well, you know what?
Are they quacks or what's going on here?
I will bring in a patient and she will sit here and tell you that she is a believer in Helminth therapy because she had severe psoriatic arthritis and we worked on everything. And her goal was to be able to either come off of or greatly reduce her need for her immunosuppressive Humira. When she came to see me, aches and pains in all of her joints, tired, fatigued, really having difficulties. And I did all of the things that we do and we've talked about on this podcast in functional medicine. But one thing I brought up, I put her on a lot of things that could impact your immune system. Helminth therapy. So I started her on Helminth therapy a year and a half ago. When she was in the worst, she was actually getting better from her pain, but she could not get beyond 2.5 weeks without needing her next Humira. Started on Helminth therapy, helping her to get to that goal. She can go every 6 weeks before she needs a Humira shot. And that started once she started the Helminth therapy. So she's getting parasites. She's getting Helminths. She's getting these worms. She takes them in capsules. We get them from a really, high level company, and it really does work.
It does, and I would say I've been shocked, and I use it very selectively, and I have patients who are really struggling, and the usual functional medicine stuff doesn't work. And I think that I've been shocked at some of the things I've seen. I had this one kid who was on the autistic spectrum, but he was also extremely allergic. And he had really high levels of IgE, which is the antibody against sort of allergens when you have allergies, like asthma allergies. And I'm like, I told him, I said, look, I don't know if this is going to work. I think the risk is very low. We use rat tapeworms, which sounds gross, but they don't actually take up residence, and they don't actually cause any real problems long term, they just pass through, but they can help regulate immunity on the way in. You want to try them? It's like, she's like, sure. Well, was it really a miracle? This kid not only had a reduction in all his symptoms and allergies and everything, but his IgE levels, which normally should be like under 100, were 1,000. And it came down to normal on this therapy. Wow. And I've had other people that have autoimmune diseases, autistic kids. It's really quite striking. Yeah. So there's something to it. You have to pick the right patient.
Absolutely.
And we'll figure it out. But
I just think that in functional medicine, the idea is that, it's not like, we just decided, oh, you know what, there's nothing else to do. Let's just, I heard about, witch doctors in Africa using Helminth, so I think I'll try that. There's a lot of research. I think we pride ourselves here at the UltraWellness Center in getting to the root cause, but really combing the literature for real data that says, it helps us find new therapies that are going to be beneficial. And so we do that. And there is a lot of studies that support Helminth therapy in reducing the severity of symptoms and response to medication in people with rheumatoid arthritis, psoriatic arthritis, MS, and asthma.
Pretty amazing, right?
Yeah, it is. So it's,
it's actually in the mainstream medical literature.
It's mainstream literature.
And yet doctors are really not doing it. And we're a little kind of on the leading edge here at the Center for Functional Medicine, at the UltraWellness Center. Yeah. And we're really focusing on what's going to work for the patients. And we use criteria like, is there scientific evidence? Yes. Is it safe? And if yes. Does it have bad side effects? Hopefully not. Is it reasonably priced? Right. Okay. And if it meets those things, we find a great therapy, but it's $1 million a dose, probably not going to use it, or it doesn't work. But so we really try things that are potentially helpful. And we work with our patients in ways that I think are pretty unique and inspiring, and it allows us to really see remarkable miracles where we often don't. So if you're listening to this podcast and you've struggled with gut issues, if you have autoimmune issues, if you have allergies, if you have cystic acne, if you have who knows what, you got to start with the gut.
Yep.
And you might have a parasite, you might have a worm, you might need to get treated with a worm or get rid of a worm. And that's part of the finesse of functional medicine.
We're either going to get rid of one or give you one. So.
Exactly. And we figure out, how to do that. And that's really the personalization approach. Functional medicine is about getting rid of the things that impair health and putting in the things that help the body thrive. And then the body can take over and with its amazing intelligence can repair and heal from all sorts of things.
Oh, totally. Yeah.
And that's what we do. So one of the complaints we see a lot is fatigue. Everybody's tired, right?